Hello friends, in today's video we'll check about the adequacy of the pelvis. Very important. The prerequisites have to be fulfilled. The first prerequisite which you will tell in the examination is I will take a verbal consent from my patient. I will ask my patient to evacuate her bladder in the presence of an attendant, preferably a female attendant. I will ask my patient to lie down in the bed and I will expose the pelvis. Now, the position should be in dorsal lithotomy position such that the pelvis is exposed. Now, first of all, I will do painting draping of my patient. I will wear sterile gloves and with the sterile gloved finger, I will insert the right hand into the pelvis. So before that, you should be well versed about the diagonal conjugate. What is the diameter, that is the distance from the tip of your middle finger to the junction of your thumb and the hand. And secondly, you should also measure the diameter of your foreknuckles. And thirdly, the maximum distance which you can stretch between the index finger and the middle finger. So these three diameters you will check beforehand and you should be well versed with it. Now I will enter my right hand into the pelvis such that the index and middle finger will go inside the pelvis and the thumb will be above the pubic symphysis. First, I will go towards the sacral promontory. If my distance is 12 centimeters or more, then I should be able to feel the sacral promontory. Otherwise, as for example, in my hand it is 11.5 centimeters. So I will tell ki I will not be able to touch the sacral promontory. Then the pelvis is adequate. Then I will go sideways and I will say that the side wall should be parallel or divergent. It should not be convergent. Next, my two fingers I will try to insinuate in the greater sciatic notch or the sacrosciatic notch. So it should be wide enough to allow my two fingers to go inside. Then I will feel for the ischial spines. So ischial spines should not be prominent on either side. Then I will put my two fingers, that is the index finger and the middle finger, and I will try to feel for both the ischial spines simultaneously. In normal condition, I should not be able to feel both the ischial spines simultaneously. After that, I will come to the anterior part of the pelvis and I will say that the anterior part of the pelvis behind the pubic symphysis, there should not be any beaking. So my pelvic inlet and mid cavity are adequate. Now I will bring my hand outwards. While bringing the hand outwards with the four knuckles, I will check the transverse diameter of outlet, and if I put my knuckles over here, I should not be able to feel both the ischial tuberosity simultaneously. That is, my four knuckles should fit inside. And this diameter is more than 11 centimeters. So outlet is adequate. Then with my left hand, I will tell that the subpubic angle should not be acute. It should be obtuse. So these are the findings which let us know that the pelvis is adequate. Now one more thing, when should you check for pelvic adequacy? You should check at the onset of labor. Why at the onset of labor? This is because relaxin hormone is released at the onset of labor, which helps in relaxation of all the muscles and ligaments. So the diameters tend to increase just at the onset of labor. So when patient comes in the labor room, at the onset of labor, we check for pelvic adequacy and we check whether normal delivery will be possible in this patient or not. Thank you.